Every family wants the best for their baby. Not just the best things, but the best life. And that means having the best health. But not every family has the resources or supportive environment needed for good health. Some mothers and babies are at a disadvantage. Even those in well-resourced families can face challenges to physical or mental health. That's why, at Baptist Health, our vision of supporting a lifetime of health starts at the beginning of life, when improvements in health can have the greatest impact in changing lives for the better. More than words on a page, we activate our vision of a lifetime of health together. Through programs that are designed to address specific health needs identified in our Community Health Needs Assessment, prioritizing maternal and child health.
Many of the things we need can wait, but the child cannot. Right now is the time his bones are being formed, his blood is being made, and his senses are being developed. To him, we cannot answer tomorrow. His name is today. One of the things that we hold near and dear to us in medicine and in the community is the importance of prenatal care and how important it is for mothers to get early and ongoing prenatal care. The reality, though, is the most important aspect of the health and well-being of the mother is not her health when she comes into the pregnancy, but the history of her health and well-being up to the point of the pregnancy.
If there's a mom and a newborn baby or a child that lives in substandard housing where the conditions are really bad, mold, insects, all those kinds of things, that will impact the birth outcome. It has already done that prior to her even becoming pregnant.
Infant mortality really is a sentinel indicator for the health and well-being of a community.
Duval County was marked as the highest infant mortality rate in the state of Florida.
There is definitely a direct correlation with a woman's health and her pregnancy outcome. When their health is not as good as it could be, they are prone to having low birth weight babies, ended up in C-sections, the inability to successfully breastfeed.
Babies born to moms that have a lot of stress are always going to be fighting uphill. When a mom's here to deliver, they're on a huge high. They've just delivered a baby, and there's tons of excitement in their family. But when they go home is when it may get hard, and they may not have someone to call or to check up on them. Welcome Home was designed to touch base with mom, see how she's doing, determine if there's any baby blues or perinatal mood disorder issues that we may need to address.
It is our responsibility to make sure that we are meeting their needs holistically while they're with us and even beyond their hospital stay. And so it's our responsibility to make sure we're providing that optimum care for them and their families.
One of the key components to Welcome Home is making sure mom has the resources she needs, whether it's mental health counseling or access to food and proper nutrition. The Welcome Home nurse is able to help coordinate that care.
Within our programs, we have many of our women, when they go home after delivery, they have many questions, especially around breastfeeding. We provide education, breastfeeding, postpartum care education, parenting. We complement the Welcome Home program, and it complements what we do as well in the community.
When we started this program, we have wonderful resources at Baptist, but we are limited on some of those resources. We wanted to find a partnership with somebody that could take this to the next level for us. We were able to bring in Healthy Start. Within their program, they actually have a nurse that is exclusive to our Welcome Home program. And once we send a patient over to Healthy Start, it doesn't mean it's the end for us. We are still very much communicating with them, helping them with anything that we can do, checking up on our moms. But they have resources within the community that we don't have access to as much. So it's really a full circle. It's the community all working together to give this mother and baby everything that we possibly can do to help them.
all women benefit from having the support provided by a nurse and or a trained professional to just help with the transition from the pregnancy into the home, from the birth into the home, to really provide support for women during a very difficult and challenging time.
Postpartum depression is huge when women deliver and go home, even before they deliver. We address that through providing an Edinburgh assessment to assess mom's depression on a scale. And from that, then we make sure that she has the behavioral health services needed to give her the support going forward.
Throughout my entire experience, Baptist was always checking in on me. It just makes you feel really wonderful going through the whole process, knowing that there is somebody, other than your partner, other than your family, somebody who can actually listen to you and hear what you're saying and then help you if you need it. It helped me know that I could be a better mother. Having somebody who's really an expert sit down with you is, I think, critical to that successful journey.
By doing a program like this, that is really what we are trying to do. We are trying to empower them to be the best mother that they can be and to keep themselves and their babies as healthy as can be.
And so personally and professionally, I applaud Wolfson and the Player Center for making this commitment to not just moms, but families that will have a very significant impact on the health and well-being of not only families, but of infants and the children and adults they will become.